of WAI, which stands for not only the Hawaiian word for water, but this is the core of our mission. And I'll kick it to Christina.
Aloha, everyone. Thank you so much for joining us this evening. I'm Christina Comfort. I'm the program manager at WAI, and I am really interested in the water quality impacts of cesspools. And I will kick it to Yoko.
Thank you very much. Good evening, everybody. My name is Yoko, and I am the project coordinator at WAI, and I work for WAI as part of my fellowship at the Sea Grant College. My background is in wastewater engineering. I'll kick it over to Raquel.
Good evening, everybody. My name is Raquel. I am the operations coordinator here at WAI. My background is in aquatic and marine biology, and I'm super excited to be here this evening.
Good to have you. And John Anner is a managing director and co-founder, but he had to move to New York to be closer with his aging parents, so he sends his regards. And we'll tell you a little bit about who we are as an organization before we jump in. Christina? Our mission at WAI is to reduce sewage pollution and restore healthy watersheds by providing innovative, affordable, and eco-friendly solutions to waste and wastewater management. And as someone who serves on the Cesspool Conversion Working Group with a number of other folks on this call, we know how important that is to help our homeowners and communities. So our vision is, and this is partly why we're having a call tonight, is to help homeowners and communities with this really difficult process of upgrading cesspools and failing cesspool systems, and trying to find new models, new innovative technologies that are more affordable, efficient, and better for the environment. And to do this, we have 6 pillars or programs at WAI. We have innovative technology, financial resources, policy and advocacy, outreach and education, and then pilot projects. And we'll talk a little bit about each of these. And we're very fortunate tonight to have this event co-hosted and co-sponsored from our legislators who have been real advocates for the environment. And so it's my pleasure to introduce Representative Lisa Kitagawa and Senator Gil Riviere, and they will say a few words. And then for our Q&A panel at the end, we'll hear from Dr. Roger Babcock, who's the newly appointed Director of Facilities and Maintenance at the City, County, and Honolulu, but is a professor in the engineering department at UH. And then we also have Cynthia Jackson and Clarissa Sacco from USDA to talk about funding, and Michael Mezzacapo from Sea Grant and Water Resources Research Center, and then our team here. So I will pass it on to Representative Lisa Kitagawa to say a few words, and then Senator Riviere can follow.
Aloha, everyone. Thank you so much for joining us tonight on this town hall focusing on cesspools. So I'm Lisa Kitagawa. I represent District 48, which includes parts of Kaneohe all the way out to parts of Waiahole. So Kahaluʻu, which is one of DOH's priority areas for cesspool conversion, is part of the area that I represent. So I'm really happy that a lot of you, I'm sure, are here from the district. And I just wanted to highlight a couple of things that might be of interest to you. So currently we're in the legislative session, and right now, you know, we're going through bills, and there are a couple of bills that actually are focused on cesspools and on assisting, you know, trying to get different kind of cesspools available and approved for usage. So there's 2 bills that I will put into the chat so all of you can see it, and you can then try and follow along if you want to submit testimony in support if it does get a hearing, but just want to highlight that. And just also want to just let you know that as your state representative, and I'm sure Gil will also mention this, but we are available for you. So if you have questions even after tonight's presentation, or you need contact information for any of the presenters, feel free to reach out to our offices. We'll put our contact information in the chat as well. But just thank you so much for attending, and we hope you learn a lot from tonight's town hall.
Mahalo, Representative Kitagawa.
Aloha, hi. My name is Gil Riviere, Senator for much of the North and Windward Shores, and including Kahalu'u, where we know there is a high concentration of cesspools. And I guess I have the distinction of having the Senate district with the most impacted cesspools near the shorelines in the state. The only district that has more cesspools is Kauai. And so it's really an important issue. We've got to improve our water for the long term. So I really want to thank the VI team for putting this on tonight and inviting us to be part of it. And I'm really glad that all of you that could tune in tonight are here tonight. So I'm looking forward to the presentation. Aloha.
Mahalo. All right, Yoko's going to introduce a survey. Go ahead, Yoko.
This is the part where we get interactive with everybody. And I will, in a minute or in a second here, actually, Raquel, could you do me a quick favor and log out real quick and log back in with your private account? It's telling me I can't do the polling because I'm logged in from another device. That would be real great. But essentially, what we're going to do is we're going to show a poll where y'all can see the questions on your screen, and you will be asked to give a quick answer. Some questions are multiple choice, and the first one is only a 2-question poll. I'll bring it up here right in a second, and then we can do that together, and that'll sort of give some quick a feeling of the audience tonight and see what everybody's thoughts are. So if I can bring it up, maybe I can't. Maybe, you know what, maybe we'll do it later. I'm getting a little error here. That happens, it's show business. So I will skip this one for now, and we'll come back with the second survey later.
Show business.
Thank you, Yoko. It wouldn't be a Zoom presentation if it didn't have some errors involved. So we'll come back to the survey. First of all, just as a broad outline of the cesspool problem in Hawaii, as most of you know, there are almost 90,000 cesspools across the state that discharge about 53 million gallons of untreated sewage into our groundwater each day. To put that in perspective, Hawaii's worst sewage spill was in 2006 in Waikiki, and that was 48 million gallons. And that closed down the beaches for a week and made international headlines. So this is what's going into our ground every day. And for many areas that are close to the coast, this leachate that comes out of it goes, it's very little room to go into the groundwater. Some, where there's sea level rise, the cesspools are already in groundwater if they're close to the shore. And so for wells that are anywhere nearby, this can be a source of contamination. And indeed, Kahalu'u and upcountry Maui are priority 1 areas where there has been documented contamination and threats to drinking water. And so we are trying to do a replacement of cesspools and also build a skilled workforce. And during the COVID-19 pandemic, this is especially important because we know that the COVID virus can be transported in wastewater, and this can go into our streams and into our ocean environment. And so give you a little bit of history and the background for the legislation. In 2016, a coalition of groups passed Act 120, and that banned the construction of new cesspools and offered a $10,000 tax break to upgrade their systems. The next year, Act 125 was passed, and that mandated the upgrade of all cesspools by 2050. And that's partly the reason we're having this call tonight. And then Act 132 passed the next year, and that was the creation of Cesspool Conversion Working Group, which myself and Michael Mezzacapo and Roger Babcock and a number of others on this call are part of. And right now we're working with Representative Kitagawa and Senator Gil Riviere and many other legislators to pass a new bill that kind of passes for when you sell your home or transfer it, that there's a mandatory cesspool inspection. And if there's a cesspool or a failing septic system, that it be converted. And this is one of the levers that DOH has to make sure that we start to convert these long before the 2050 deadline, especially when there's money on the table.
So as part of the Act 125 that was passed in 2017, the DOH was required to provide a report of conversion priority areas. So this basically entailed looking at all the cesspools that are present in Hawaii and deciding which areas are the most risky in terms of risks to public health and also to the ecology. So there are 14 areas that have been designated around Hawaii as priority areas. They're labeled in priority 1, 2, and 3. So I'm just going to briefly go through what those priority categories mean. For priority 1, this is the significant risk category, and this is the category that Kahalu'u is in. And this basically means that there have been documented impacts to drinking water, public health, and ecology, and that these impacts can reasonably be affiliated with the cesspools in the area. For areas that are designated as priority 2, it's likely that the cesspools in the area cause impacts to drinking water resources. And for priority 3, there are likely impacts to ecologically sensitive waters, and that includes things like coral reefs, streams, and waters with endangered species. There are a lot of other cesspools that aren't included in a priority area yet, and these are currently identified as priority 4. That means that impacts haven't been identified. So they either haven't been assessed yet, or the impact to water resources appears to be low. So we're going to stay focused on the priority 1, 2, and 3 for now. On Oahu, we have 5 priority areas. So you can see on this map, Kahalu'u is one of them, and then also Waimanalo, Diamond Head, Ewa, and Waialua. All told on Oahu, there are about 11,300 cesspools, and those cesspools discharge 7.5 million gallons per day of effluent into the groundwater. So that's a huge problem for the island, and we're going to focus in on Kahalu'u today, but definitely to be aware that this problem is happening all over the island on all of our coasts. So again, Kahalu'u is priority 1, and the rest of the priority areas on Oahu are priority 3, meaning that there's potential impacts to ecologically sensitive waters. Zooming in on our priority area in Kahalu'u, on the map, you can see the red dots each indicate a cesspool, and the blue area that's shaded is the boundary of the priority area. This area has 740 cesspools that discharge 440,000 gallons per day. And many of these cesspools are really close to drinking water resources and streams. So this is the main reason that Kahalu'u is a priority 1. There's also listed are all of the representatives for the area so that you know who your representatives are, and Representative Kitagawa and Senator Riviere, again, thank you for being here and co-hosting this meeting with us. A little deeper look into why Kahalu'u has been designated a priority 1. First of all, in 2014, the Department of Health took samples in the lagoon in Kahalu'u and found high counts of fecal indicator bacteria. And fecal indicator bacteria is basically a type of bacteria that you can culture easily in a lab and that is associated with sewage pollution. So this is something that's not typically the bacteria that would make you sick if you come into contact with it, but it's indicative that there could be other pathogens in the water, and it's likely that there's some sewage contamination into that body of water. Surfrider Foundation has also done very consistent sampling at Kahalu'u right by the boat ramp since 2018. So we have a really good time series, which I'll show you on the next slide. There's also been oh, sorry, can you go back one? Thanks. There's also been skin infections reported from Kahalu'u, and as I mentioned before, there's a high density of cesspools close to waterways and drinking water. So here is the chart that I was talking about, showing our fecal indicator bacteria time series from Surfrider Foundation's Blue Water Task Force. So this is basically a record of biweekly sampling since 2018. If you look on the vertical axis, the y-axis, the threshold for beach closure is indicated by the red line. And the yellow line is a conservative value for, basically it means it would probably be a good idea to not go in the water at that point, but by the red line, the beaches really should be closed. And I also want to point out that this axis is not linear. So when you're looking at, say, like the fourth bar, you're actually looking at a concentration of about 10,000 enterococcus units versus the threshold for beach closure is 130. So this area is regularly experiencing sewage contamination that is above the levels where the beach should actually be closed. And this is an area that's used for fishing and recreation. There's the canoe club right there and nearshore coral reef habitat in Kaneohe Bay. So you can see this is a really severe chronic problem in the area. Next slide, please. So what does it mean for health and the environment to have this much chronic pollution in a region? Sewage pollution has really severe impacts for public health. Of course, since the drinking water can be impacted, that's kind of a no-brainer, right? You don't want to be drinking contaminated water. And with sea level rise, and the groundwater table can rise along with sea level, will be starting to run into more problems with cesspools being directly within the groundwater table. So that's something that is only going to get worse as we move forward, and underscores the urgency of the conversions that need to happen in Kahalu'u. As far as the pathogens in the water, Hawaii has about 4 times the rate of staph infections and 2 times the rate of MRSA infections as the mainland. It's definitely possible and likely that is connected to the cesspool pollution problem. But you can also get gastrointestinal illnesses through contact with sewage, conjunctivitis or pink eye, and other types of diseases. And finally, as far as public health, there are also contaminants of emerging concern. And these are things like pharmaceuticals and other types of chemicals like agricultural chemicals and sunscreens, some of which are present in sewage, especially the pharmaceutical chemicals. And we don't really know what are the long-term effects for public health or for environmental health with the contaminants of emerging concern. On the environmental side, sewage has a lot of nutrients in it. And when the nutrients enter a coral reef environment, it actually leads to algae taking over the reef. Algae does a lot better with high nutrient waters than coral does, and the algae can grow over the reef and smother the corals. In Kaneohe Bay, there's a lot of invasive algae, so it also encourages the growth of invasive species. Sewage pollution also leads to incidences of coral disease and reduced coral cover. This photo right below there is a coral from Pu'oko on the Big Island that has a lot of growth anomalies, and that is directly correlated with sewage pollution in the area. And I'll pass it to Yoko to talk about what to do about this problem.
Thank you very much, Christina. Yes, so a question that many of you probably have asked yourselves is, what do I convert my cesspool to? So I want to list a couple of options here. And like my boss Stuart likes to say, we have to have a lot of arrows in our quiver if we want to be able to tackle this problem. So every house, every cesspool sort of requires its own unique solution. But here are a couple that we partner with and that we like to promote because we think they're great. The first one here that you can see on this slide is the Cinderella incineration toilet. And what it does is really what the name says. It incinerates both number 1 and number 2. So that means there's no water needed. It's a waterless toilet, and there's no sewer hookup needed, which is fantastic, especially for rural locations, such as on trails or at campsites. But it's also really great for residential uses. Let's say you want to add a bathroom somewhere and you don't have to do sewer pipe. Like I said, the ash that is created in this process is pathogen-free, it's odorless, and it's really small in volume. So for a regular family of 4, the ash canister in the bottom of this toilet would only have to be needed, once a week to be emptied. There we go. And we have successfully facilitated the installation of 2 incineration toilets in Hawaii. One is at HIMB at Moko'oloi, and one is at Kuilima Farm on the North Shore. And these are units that are accessible for the public. So if you're interested, please contact us. We'll have a slide with our contact information later, and we can facilitate that you have a look at these yourself. These toilets are from Norway, and they come in 2 different kinds. The first is an electric model, so you can just plug it into your wall. Or the other one is for when there's no electricity available. It's a propane powered model that can be combined with a solar panel and a little car battery. So it's great for off the grid use, such as the ones that we have installed here in Hawaii. I also want to highlight options that are able to treat all wastewater, not just toilet wastewater. The current sort of go-to oftentimes is a septic system, which is, to give you a little refresher, a septic system is usually a septic tank for treatment and a leach field for wastewater disposal. And the septic tank really does very preliminary treatment. It's not really high quality what comes out of a septic tank. It's just the solids are removed. But what we like to promote here, and what we believe is the solution in the future, are either enhanced septic systems or aerobic systems. In the middle here, you can see an aerobic treatment unit. One brand that we partner with that makes really advanced aerobic treatment units is FujiClean. And what they do is they replace the septic tank. So you would have the aerobic treatment unit and then a leach field. And they provide, through electricity, small air bubbles so that the bacteria that live in our guts that are aerobic bacteria and way better at cleaning up wastewater can survive. And so that yields a very good treatment. And then we also have non-electric systems that use nature-based mechanisms to clean our wastewater. The first one here on the left, you can see is a biofilter. One company that we partner with that does this is Elgin. And what they're basically doing is they have the septic tank and a leach field, but below the leach field, they have a layer of wood chips, and they make sure that the sand layer above it is well aerated. So again, you have aerobic bacteria that can survive there, and they're great at breaking down the nutrients, such as nitrogen. And then on the right, lastly but not leastly, we have a constructed wetland, for example, made by the group Ridge to Reefs, which we partner with. And they are also a nature-based solution that uses a combination of plants and different materials to break down the waste, and then you have a leach field after that. So there are many options, and the perfect one can be chosen by an engineer for your house as well. These were all, the systems that I just talked about were all for one house. So there are single residential house or maybe 2 houses, but we're also looking at community solutions or clustered systems, as we sometimes like to call them. And they're able to serve an entire community, an entire village. And one of these solutions that we partner with is a company called Cambrian Innovation. You can see here on the left what one of those looks like. To give you a size comparison, the right object there, the more boxy object, is about the size of a shipping container. And so what they can do is they can not only produce very high levels of treatment through cutting edge technology, but they also have an innovative financing model, which I'll get into later. But the great thing about Cambrian is that they are modular. That means they can be expanded really easily if demand grows. And they are also maintaining their own products themselves. So no O&M, no operation and maintenance falls onto the village or onto the client. And here's the financing model that they have. They call it the WEPA, the Water Energy Purchase Agreement, where there are 3 parties involved. Ideally, you have a community that produces wastewater, and that wastewater is sent to the Cambrian wastewater treatment plant. And Cambrian is able to construct, operate, own, maintain everything, their wastewater treatment plant at no capital expense to the community. They do that by instead charging a monthly fee, like a sanitation as a service model. And so that monthly fee is then given to Cambrian. That's pennies on the gallon. And on a residential strength of wastewater, Cambrian then sends the clean water, they clean it up really well, and they send it over to a nearby landowner, for example, to set up a green belt, which is great for many reasons, for wind, fire protection, everything. And that's then where the wastewater treatment plant is sited, which is a great way for avoiding upfront cost if a community has to upgrade their wastewater systems. I'll pass it over to Stuart.
Thank you, Yoko. So in order to kind of help the community figure out ways that we can deal with this cesspool problem, across the state, after the pandemic hit, we partnered with a group of people, several of whom are on this call, Dr. Roger Babcock and Michael Mezzacapo, and Dr. Rachel Solomsas at the University of Hawaii Community Colleges, and the Water Resources and Research Center at UH, to come up with this Work for Water program. And the 4 stands for the 4 counties that will be doing these conversions in, and the 4 goals of workforce development, infrastructure investment, cesspool replacement, and all of these in the name of water protection. And so this is a way to kind of get people back to work and help with these cesspool conversions. And so I'll ask Roger to kind of help with the next slide, or I'll do this one, Roger, you can do the next one. We are doing, our goals are to reduce the public and environmental health risks that are associated with sewage pollution. But also in the pandemic, with the economy the way it is and so much unemployment, we went from, the lowest unemployment rate in the country before to the highest rate in the country after the pandemic. So we want to help jumpstart Hawaii's economy by creating shovel-ready projects to convert cesspools in really the most at-risk areas like Kahalu'u. So we think this is a great opportunity to bring this to your community. And we also want to help create a blueprint so the state and each of the counties can find a way to really make this happen sooner. And because we have a lot of cesspools to convert, with 90,000 working over the next 30 years, we'd have to be doing 3,000 a year, 3,000 conversions a year. And right now we're doing about 150. So we really need to step this out. But the opportunity there is that if we develop training courses in the wastewater sector at the community colleges, we can work to create long-term, well-paid jobs that are not dependent on tourism. So you won't have that boom and bust cycle, of tourism or some of these other construction projects. These are long-term, well-paid jobs. And by that, we can help the state as well, contributing to revenue through job creation and income taxes. So we think this is a good way to move forward. And Roger, I'll kick it to you. And you might be on mute. Roger. All right. Well, I'll take this one.
Can you hear me now?
Oh, there
Can
you
you
go.
hear me now?
Yeah, thank
Okay.
you.
So the solution that we came up with, and it's, just to be clear, this is a proposal for which we're seeking federal funding, but we have not received the funding for Work for Water yet. But this is what we're trying to do, is what we call Work for Water. Stuart mentioned what that stands for already, and there are several components, as was mentioned also. We want to do 100 cesspool conversions in each county and focus on the highest priority areas, including on Oahu, that would be Kahalu'u. So there are several components shown in the diagram there. Public outreach is an important component, which is why we're here this evening. We need to get people to understand the problem and what their options are for their cesspool replacement, how much time they have, what it's going to cost, etc. Then all on-site systems require a permitting process and a design process, and we propose to do all of that as Work for Water, as a service that's not charged. Then there's the manufacturing and installation. There are some systems that are manufactured in Hawaii already. There will be more in the future. Installation is done by local companies, of course. These are small construction companies that have the correct licenses to install systems. And however, that workforce needs to grow. Both of those components, the permitting and designing, we don't have enough people to do 3,000 a year. We need to build up that workforce and get people trained. Same with the manufacturing and the installers. There aren't enough to do all of these installations. So there's workforce development involved. Once they're installed, then they need to be operated, maintained, inspected, and evaluated. So the evaluation is part of the Work for Water sort of study to see how some of these newer innovative systems work in the field under actual conditions at people's homes. So we would be collecting samples and monitoring how well they perform, and then getting them approved for everybody else to use. So it's not that they don't work, they do work, but they're not sort of proven here, which is what's sort of necessary in order to get them to be readily used and approved by the Department of Health. So there's a sort of a study component. And again, we don't have the inspectors and we don't have enough of the operators and maintainers. So the idea of Work for Water is to start to generate this workforce, and to do that not ahead of time, but while we're installing and having these systems put in the ground in a two-year period. You do the training, sort of on-the-job training while we implement this solution. And again, it's to make a model for then the other almost 90,000 cesspools that need to happen statewide. So the idea is this is jump-starting the whole program, and we're hoping that we can do this in Kahalu'u and with some homeowners that are hopefully on this call. And the Work for Water program, assuming the federal funding comes in, it would essentially pay for half of your conversion. So that's the model that we're looking at. Next slide. So very briefly, this fits into something called a one water holistic approach. There's a lot of words on this slide, but basically it's kind of what it's saying is that we need to consider water of different types, and it's all water. Some of it's wastewater, some of it's stormwater, some of it's drinking water, and all these things are tied together, and there's really just one water, and we need solutions and approaches that consider all the different types of water, because water moves between these different areas, and sometimes it's drinking water, sometimes it's stormwater, sometimes it's wastewater. And so this project is helping to contribute to that, and that's a sort of a federal approach, newest approach to thinking about water.
Great, thank you, Roger. And one of the parts of that he's mentioning is basically we're really looking to get homeowners to sign up for this as we seek federal funding to launch this Work for Water project. We need homeowners that are willing and ready and able to move forward with us and to receive these subsidies. So it depends on our funding, but we've heard a lot of positive responses from Washington and from our federal legislators who say this fits well with not only the state mandate to convert the cesspools, but also workforce development here and across the country. So if you're interested, please sign up at this. This should be a hot link, and we will be sending out this presentation to everyone. But it's tinyurl.com/cesspool conversion for those who are on the phone. And there's a link also in the Eventbrite in the flyer that went out. So you can sign up there, or you can go to our website to sign up. And now I want to introduce our next speakers to talk a little bit about potential funding opportunities from the USDA Rural Development Office. Cynthia, if Cynthia could come on, and Clarice, they can tell us a little bit more about available funding.
Can you guys hear me?
Yes.
Okay. My name is Cynthia Jackson. I'm the Housing Program Director for USDA. And we have grants and loans available to individuals for the Cesspool reconstruction. And so I would like to introduce Clarice, who is our expert on Oahu, and she can tell you more about it. Clarice.
Hey, Clarice, I think you're going to need to speak a little bit louder.
Hear me now?
I can barely hear you.
Clarice, we can't hear you. Okay.
Okay. Well, maybe Cynthia, if you want to just finish this slide, and then you guys, both of you can come back for the Q&A.
Sure.
Thank you.
We have loans up to $40,000, grants up to $10,000 for senior citizens. Eligible areas, you guys are all eligible. The entire area is eligible. So basically, if an individual and they own their home and they qualify, we can give them up to $40,000 loan for the Cesspool conversion. Grants up to $10,000. I mean, it's free money. Anybody who's 62 years or older and they live in this eligible area and they need to get a cesspool conversion, $10,000 grant money. Now, I do need you guys to get in touch with Clarice as far as eligibility and that kind of thing, but you know, we've got money, and that's what we're here about. That's what we do, rural development.
Thank you, Cynthia. And yeah, they've been very helpful with us, and we can also help with the process of going through the application. Cynthia and Clarice will be available during the Q&A, and then we have some helpful links coming up that can take you to the site.
Yes.
And in the meantime, right now, we're going to try the survey part 2. I'll kick it to Yoko.
Yeah, so I still can't do it, but just because I can't do it doesn't mean that nobody can do it. So Christina, give it a try.
Okay, I'm going to try to launch the poll here. And just so you all know, this is an anonymous poll, so no stress. Don't worry if you don't know the answer to something or if you're not sure what to put. It's not like a wrong answer or anything like that. And everything is, again, anonymous. So here we go. Let's see if it works. You guys can see it? That's great. Okay, so question 1 is, what barriers exist for residents of Kahalu'u to convert their cesspools? So what do you guys think are the problems that are holding back residents from making these cesspool
I think
conversions?
this is the result. Sorry to interrupt you, but the one I'm seeing is just showing the results of it, but not the options.
It says it's in progress right now.
Okay.
Can anyone vote?
Maybe Stuart, because we tried this out in practice time, so it might just be your results. But
Okay.
Dr. Babcock, for example, can you verify that it works? Yeah. Okay, great.
The poll shows up, guys.
Okay, thanks. So, yeah, so you can select multiple question or multiple responses for some of them. So if there's multiple places you can check boxes, feel free to answer more than one thing. Second question is, are you concerned about human and environmental problems posed by the cesspools? And third question, what value would be the biggest motivator for residents of Kahalu'u to convert their cesspool? Options are clean environment, public health, improved property value, or regulations and law abiding. Okay, it looks like maybe some people can fill in questions 1 and 2, but cannot submit. Okay, I'm getting some responses though. So hopefully for some people, it's working. Okay, here, I think the responses are starting to come in now. Okay, number 4, if up to $20,000 in financial aid was available, would you be more willing to convert your cesspool in the next 1 to 3 years? And question 5, complete the sentence, select all that apply. I'm concerned about water quality as it relates to sewage pollution for swimming, fishing and traditional practices, drinking water, coral reef health, or I don't have concerns. So I'll give you guys a little bit more time to respond. It looks like we've got about half of the responses at this point.
I think you have to scroll to move down through the survey, those that are having trouble. And you also, I think you have to answer all the questions before you can submit.
Yeah, so I want to just say thank you, everybody, and especially Christina. This was sprung on her in the last minute. So Christina, thank you so much for going through this poll with everybody.
No problem. Yeah, and thanks Roger for the input, but yeah, you have to answer all the questions before you submit. But it looks like we're doing pretty good. A lot of folks have answered the poll. So nice job, everyone. I'll give you a little bit more time.
We'd have to answer and then go to next. When you're done with the survey, then you can submit.
Thank you.
Appreciate that. First time, there's always going to be some hiccups. So we appreciate your patience and bearing with us.
I think we need like some mood music next time, a little soundtrack for the
Yes.
polling.
You want to start maybe at the top, and then people can continue as we're going down, you think?
Sure, yeah, I can start reading out some answers as things are coming in still. We'll leave the polling open, so if you haven't finished and you're still working on it, no worries, no rush. But just to kind of share some of the responses, we're seeing that 91% of respondents cite the cost of converting as the major barrier, along with 60% worried about the construction impact on the property and 45% saying they don't know how to start the process. And there's 16% are concerned that maybe folks don't feel that it's important. So hopefully we can help at WAI, hopefully we can help with all of these issues and be able to, point you to places that and engineers that can help you get the right kind of system for your property, and also with financial resources with the cost. We do recognize that that is a huge barrier. With this mandate, it's unfunded, and we are working really hard to try to find funding to help homeowners. We've got 91% of folks at the meeting saying they are concerned about human health and environmental problems posed by cesspools, and a few have responded that they need more info. So whatever kind of information that you still would like to know, please drop that in the chat or bring it up in the Q&A, and we will work on getting that information out to you. What value would be the biggest motivator for residents to convert their cesspool? Clean environment, public health are pretty high on the list, and 50% of respondents also chose improved property value and abiding with the mandate. So it seems like, we're all really connected to environment and the health of ourselves and our families. So it's great to see folks feeling that that's really important. And yep, the 62% are more willing to convert with the potential for financial aid. And we will give you in the, definitely a link so that you can sign up to become eligible for this. And we will keep you up to date as we work through our grant processes and appropriations process to try to achieve these funding opportunities. And finally, the concerns about water quality, all of the responses got really high answers. So, so it's good to, you know, recognize that this is a holistic issue. It affects lots of different things. And thank you guys all for participating in the poll. Does anyone need more time, or can we move on? Looks good. Okay, thank you so much, guys.
Yeah, thank you so much for helping to orchestrate that and for participating in it, folks. We appreciate it. For our next slide, we have some helpful links that you can, you know, we'll be sending out this presentation to everybody who signed up, sharing the recording, but we also have some links that are worth checking out. So you can sign up for the Work for Water, and you know, they can go to that teeny URL site and be eligible for subsidies. We also have our VI website at ycleanwater.org and learn more about cesspools from DOH and EPA. And those are the DOH site and the EPA below. You can learn more about loan applications from the USDA at the link right there, rdusda.gov/programs/services, dash services, I should say. And then we have folks from Sea Grant here on the call and Water Resources Research Center. And so we have links there as well for you to check out. And so we really appreciate you all taking the time to learn about this issue, because it is one of, you know, the more pressing issues facing us across the state, especially during this time of the pandemic. So we appreciate your concern, and we're here to help. We really all have a common shared goal of you know, having better water quality and helping you know, helping the state with this issue. So now we want to you know, open it up to our Q&A with our legislative representatives, Representative Kitagawa and Senator Gil Riviere, and then also Dr. Roger Babcock, Cynthia and Clarice from the USDA, and Michael from the UHC grant. So if you want to put questions in the chat, feel free to do so. And we can kind of start with those. If Christina, Yoko, you want to read some of those that we have.
Sure, I'm just scrolling back through the chat to find some of our early questions. Let's see. Okay, someone has, Hannah asked if there are any large capacity cesspools known in the Kahaluʻu area that have not been closed out. And just to briefly answer that, large capacity cesspools were supposed to be closed in 2005. And this is an issue that will be actually handled by the EPA. So if anyone knows of any, the EPA should be contacted about it. Mike, do you have anything else to add about that?
No, I sent her some links, and Wes as well gave some information to you.
Okay. Next question, when you say Kahaluʻu, does this include the strip from Heʻia Boat Harbor going towards the North Shore? We can flip back to the map of the priority area that is included in the Kahaluʻu kind of designation. Yep, that's right there. So it does, so if the boat ramp is, you can see the bridge, and then there is a strip heading up towards the North Shore that is included in the priority area. Let's see. What if we do all of these changes and the water quality does not change? Yeah, that's a great question, and you know that's something that we're really interested in looking at. We are going to be doing water quality monitoring, and one of my goals as a program manager at WAI is to really broaden our reach in the water quality sector and make sure that that we are connected to and Department of Health and supporting and integrating the efforts to monitor water quality, especially around these priority area conversions. It's also important to remember that sewage pollution from cesspools is one aspect of water quality, but as Roger mentioned in the One Water approach, there's also stormwater pollution and sedimentation and erosion that comes from the lack of native forests and invasive species, ungulates, and things in the mountains. So there's lots of aspects in which the water can be polluted from the land. So we really want to work with partners who do water pollution work from a variety of angles and really take a One Water approach to have a holistic look at this issue.
Another question that pops up, we can start going down the line and feel free to jump in, you know, with our speakers. But someone asked, have you folks looked into anaerobic digesters to provide both sewage treatment and cooking gas for individual homes or power for collective systems? Maybe one of our wastewater engineers, Roger or Yoko?
Yeah, so anaerobic digesters are possible, and they can do the things that you mentioned. However, for an individual home, that's not considered really feasible to be dealing with combustible gases and produced. That's done at large-scale treatment plants. So an on-site system for a home needs to be simple, resilient, robust, and not have to manage byproducts.
Yeah, one thing just to add that we didn't mention was we are looking at clustered systems like the Cambrian system, the decentralized kind of wastewater treatment plant that Yoko had talked about. And that is something where if we've got enough people in a community, even Kahaluʻu, this would be, you know, a potential solution if we can create a sewer improvement district where you just need, you know, more than 50% of the population agrees to do this, then you can bring in collective systems like that. So it doesn't have to be done home by home. And so if there's interest in the, you know, starting a sewer improvement district, we can also talk about that and follow up on that offline. Melody asked, is the Cinderella toilet available today or not available yet? Is this the only type of self-contained toilet that may be available? Wouldn't this be much better for the environment than a septic tank and leach field? Does somebody want to take that one?
Sure, the Cinderella toilet is available today. There's a local rep. You can get that information from WAI in order to be able to purchase one or more. There are other manufacturers in the world, but getting it here from somewhere else could be a challenge. But there is, like I say, it is possible to get these particular ones in Hawaii today. And I think the answer to your question about whether that's better for the environment is yes. It's a zero discharge type of system, meaning it puts no pollutants into the environment. So yes, that is, in that sense, it is better.
Thank you, Roger. And if you're interested, you can contact us and we can put you in touch with the local distributor who's doing that. And kind of in that same vein, someone had asked, are there, you know, why aren't we doing more composting toilets? That this is a good option. Keliko asked, why have you chosen not to explore more composting toilet options upgrading to a high quality composting system is much more affordable and eliminates the use of clean drinking water from waste elimination.
I'll take that one also. The composting toilets are feasible again. However, and they are available. They can be purchased. And so that is the main perceived possible issue associated with that is that there's more of a hands-on and user maintenance requirement that may make them less attractive to, say, an average person. It is not a, you would have to have active sort of participation in your waste management on a regular basis. And that means handling contaminated stuff and putting in sawdust and doing something on a regular basis and worrying about odors on a daily basis. And this would be something that's inside your house, presumably. So it definitely would be less attractive, certainly than your current flush toilet application, as well as the incinerating type toilet. So and so there are some health concerns if it wasn't done properly. That doesn't mean it can't be done, and there will be some people who would like that option, and for those people, that is, I would say, fine.
Yeah.
But yeah, it's definitely not for everybody, a composting toilet.
Yeah, and DOH has some concerns about that, as Roger mentioned, just because you have to handle raw sewage. And so that's their concerns. A question before that Nalehu had asked was, how many cesspools would we need to convert in Kahalu'u to make a dent in the nearshore water quality? Which is a really good question, because that's what we're going for. We want to concentrate on certain areas and show that there will be improvements in water quality. This is kind of a speculative answer, but Christina or Michael, do you want to take a shot at that question?
Sure. So that is a bit difficult to answer, only because, as Christina mentioned, there are other sources in the environment that can also add to pollution and contamination. So, but in general, there should be a significant amount of the area. You wouldn't want remnants, and location would also matter. So let's say you missed a bunch of upgrades along the coastline. Those have a much faster and more direct path to the water versus someone that might be closer to the mountain. So that's also important. So it's you know, it's difficult to answer, but I think in general, it's safe to say that if you capture a majority of them, you're going to see impacts to water quality. And that's, you know, and that's an important factor of why, you know, the state has mandated that everyone convert versus just, you know, a select few, and why the priority areas are also important as well.
Yeah, thank you for that, Michael. And, you know, kind of adding to that, you know, we want a success story. So, you know, for those of you who've been in the area for a long time, you remember when the water quality was really bad in Kaneohe Bay. There were a lot of open sewage outfalls, and there was kind of chronic sewage pollution. And once they repaired a lot of leaky pipes and got rid of those outfalls, the bay really had you know, well-documented kind of recovery that you know, we take to heart, because that's something that we want to see again. And so the resilience of the coral reefs and the fish populations, you know, it's there if you reduce the input of nutrients and sediments and the cesspool pollution. We can see, you know, measurable turnaround long term if we do enough of them in an area like Michael said. And the Lahui Foundation asked, is this something that will expand other residents of Oahu outside of Kahalu'u? Yeah, and I'll just answer that real quick. We are going to be doing, this is the first of our town hall meetings, but we'll be doing them across the county and across the state. and we just starting in the kind of highest priority areas first. But yes, it'll be available throughout the state. And Patrick Meyer asked, what is the anticipated timeline from some sort of application date to construction completion? Yoko, do you want to take that?
Yes, absolutely. So maybe I'll first give a little background of what a usual individual wastewater system or cesspool conversion looks like. So the homeowner would contact an engineering firm. VAI is able to help find the best engineer for the job. And the engineer then works with the homeowner to create the system that works best for the property and for the budgetary and site constraints. And that is then permitted with the Department of Health wastewater branch. That process from initial contact to permitting can take, depending on the difficulty of the system and the communication, can take between 2 weeks and maybe a month. And then after that system is permitted for construction, the engineer or VAI can help the homeowner find a licensed contractor to install the system. And that, again, depending on many factors, can take between 2 weeks and a couple of months as well. So overall, a real fast, real easy project can take between 2 weeks if you're insanely fast to a number of months, but ideally you would see these projects be done between 1 and 2 months. And in terms of the application that you mentioned, so if you go to that tinyurl.com/cesspool conversion, that link that we showed earlier and that we're going to be sending out to everybody, we will contact you back within a couple of days, and it will be determined what the best way for you will be. Right now, as Dr. Babcock said, the funding, the federal funding for the Work for Water has not come in quite yet. We're working very hard to make that happen. Once that federal funding comes in, that individual wastewater system upgrade process that I just said, the cesspool conversion process, will start almost immediately. So that will be a matter of months. But if there is more urgency and a person wants to upgrade their cesspool, maybe with USDA funding instead of the Work for Water, then you can still apply through that same link. It's a very simple form, and we'll get back to you, and that process will get started immediately. I hope that answers your question.
Yeah, thank you, Yoko. And Randy Gauntz mentions a really interesting point. He has done like 5,000 hours of research into include historical analysis of the WAI. And he said, I want to express the need for an environmental justice lens and restorative justice solutions to be offered. Communities should also have mechanisms to be empowered to stand up for themselves for a long-term and holistic solution, not just accept the terms of bearing the burden or fixing the Western waste management practice. And we agree, we're looking at this also through an environmental and social justice lens. And a lot of these areas have demographics that are very poor, and there's no way they can afford these conversions. And so part of Work for Water, 30% of those who apply who meet the threshold for low income, we would pay for the whole system. And so this is dependent on funding, of course, but we definitely hear what you're saying, and that's why we're here, to kind of help, because we do believe that there are a lot of areas where they're worse in the demographics. The people in those communities need support and help with that. The Yamada household asks, could you provide one comparison table showing approximate cost of the different systems for each household? Yoko, you want to kind of follow up on that one as well?
Yeah, absolutely. As you can imagine, asking an engineer specifically about cost always makes them nervous. So I'm gonna be sure to give a very diplomatic but truthful answer here. So the system size and the site constraints and homeowner preferences make a huge difference in these. And so you can go from something like a small 1-bedroom house in sandy soil, which means that the leach field is small, to a 5-bedroom house with a very small lawn on a slope, which just makes everything very difficult. Maybe you're in clay soil, something like that. So it's very tough to give price ranges. But we can usually say that most or many of these cesspool conversions range sort of in the $20,000 to $40,000 range, including engineering and construction. And we're trying very hard. We know that's a very high amount. So we're trying very hard to bring this down with innovative funding. Some of the technologies we're bringing to Hawaii right now are able to bring that down. And we realize that most of you said that financial resources are a big holdup on the situation. And so that's just the number that I will give right now. Obviously, systems can be more expensive or they can be cheaper depending on situations, but 20 to 40,000 is sort of the range where we see most of them.
Thank you, Yoko. And next question is, if we are outside of the Kahaluʻu area, can we still apply for the loan? Yes. We're going to be doing these town hall meetings around the area, but we're focusing on certain issues first, certain areas rather, but this is available to all people. So please do apply and let us know. And even if we're working on something called a potty portal. So we want to have a place where anyone can go to find out information about different contractors, different engineers, different pumpers, those links that we showed you, all the information. So we're looking to get a grant to do that because we just want to help homeowners get that information, because we need to make it easier for them to do the right thing. But if they can't get the information, it's difficult. Kealoha says, mahalo to the organizers and attendees. Is there a time or financial cap that limits the Work for Water grants? Could you repost the link to register? So yeah, we can repost that link. And Roger, do you want to talk about like the time frame or financial cap for the Work for Water?
Time frame. What was financial cap? What's that? What's the question?
Is there a limit to to that? So I think we're scaling. We're trying to do 400, but if we got more money, we could do more, and if we get less money, then we'll do less. I think that's what that question's about.
Yeah, we were looking at a $10,000 subsidy per. Isn't that right, Stuart?
20,000 currently. Yeah.
Yeah, $20,000, right?
Up
we
to
were
20,000, yeah.
$20,000. Yeah. So, but we'll see what we're able to get in terms of federal funding. But it's envisioned as a cash subsidy as opposed to a tax credit or something. Yeah, so it really depends on what sort of funding we get. If as part of the funding ask, we'd like to be able to say we have all these people who are ready to receive this funding if you give it to us. So that's part of the objective of the public outreach.
Mm-hmm. And at the Lahui Foundation, they asked, there are many areas that affect the lo'i patches, as that is something that is directly affecting a stable food source, especially in this area. How come this is not part of your discussion? They may want to take that. We are, reaching out. To give a little background, WAI is kind of still in its adolescent years or toddler years. This is our first year in operation, and we've taken on one of the biggest issues in the state. So we are reaching out. We've reached out and are working with Mahina and others, because the fish ponds are an issue, and we want to make sure the water is as clean as can be. So that is part of our discussion. We just didn't have time to put it in here because this was more of I think an emphasis on cesspools for homeowners, but it affects, as you mentioned, all our fish ponds. near shore areas, and even food production and the quality of the water going into the streams. Rick Towell, who is also an engineer in the area, says a question particularly in our area, within 100 inches, with 100 inches of annual rainfall and high water table, you can do any number of IWS or individual wastewater designs independently based upon a percolation test. And at what point does a particular area with many IWS systems become at capacity? Roger, do you want to take that one?
I can also help if you need, Roger.
Go ahead. Either way, go ahead, Yoko.
Thank you so much. Yeah, so the Department of Health has a requirement for new developments to have a maximum of 50 lots to have individual wastewater systems. Anything else will have to be more sophisticated, like a zero discharge system. But for existing developments or existing villages, existing towns, you can upgrade cesspools 1-to-1. So convert a cesspool into an individual wastewater system, such as an aerobic system, for example. And there's no maximum limit there, because all you're doing is you're steadily improving the environmental impacts, and you're steadily improving the water quality. So there's no technical limit on existing development.
Yeah, and Kukahiko and Tyra have a good question. When will a sewer main come into Kahalu'u? And once we pay to convert these to these new systems, will someone decide to bring the sewer line into Kahalu'u, requiring residents to tie into that system? Roger or Yoko can answer this.
Yeah.
Part of the reason we're doing this is, but even before the pandemic, there was very little likelihood that they were going to extend the sewer system into these areas, because the counties just don't have the money. It's about $1 million per mile or more to lay down sewer, and with some of these areas just being 2-lane highways, it totally disrupts traffic and cars, and there are areas often where there's sea level rise. But now that the pandemic has hit and there's such an economic crisis, we don't think sewer is going to be coming to these areas for quite a long time. If ever, because it's the most expensive form of treatment. And so even per capita, when you divide it up, it's extremely expensive. And so these systems are actually in some ways much more financially and physically effective. But I don't know, Yoko, if you and Roger want to add to that.
It's probably quite unlikely that the area would become sewered in the future. It is technically possible that it could be, but it's very expensive investment for the city, and generally most unsewered areas are going to remain that way. The county isn't, none of the counties are itching to install more sewers. They would rather have the areas be responsible. And perhaps if sewers were to come to the area sometime in the future, it would be a good assumption that residences that had a full sort of secondary level treatment system would not have to connect. Those with cesspools certainly would, and those with the more inexpensive type systems that don't provide a significant amount of treatment would have to connect. So.
Yeah,
I can add to that too as well, Stuart. And just to preface, I'm not part of the Department of Health, but being on the cesspool conversion working group, the Department of Health is keenly interested in working with the counties because they are the ones that would be expanding sewers or the smaller lines for smaller communities. And so that's an important step that they're working to remedy, so that they can understand where a county's looking to expand and where are they not. And so that we don't kind of, have people convert and then all of a sudden turn around and tell them, hey, now you have to hook up to the sewer. So there's a lot of planning and effort that are going into that process. And I think that, you know, the more people voice that concern, that's good to their local representatives and constituents.
Yeah, that's a good point. And, you know, the sewers, sometimes we think, oh, well, that's going to be the answer to everything. But, you know, the homeowners have to pay for the laterals to get to the sewers. And these can be really expensive, and they might ask to help subsidize the cost of the sewer in the area. So it can be an equally expensive proposition. Lehua asked, says, mahalo for this excellent presentation. It's an eye-opener. She says our properties have multiple ownership, which is an issue. Someone asked earlier about, you know, rental units versus homeowners, which is challenging. But she asked, what is required for conversion? So does anybody want to take that?
Yeah, I can take a stab at it. So multiple ownership can be obviously in the form of CPR. So if a condominium property regime, the property has been CPR'd into several subunits, then every subunit owner is responsible for the upgrade, and there has to be conversation because certain areas are only allowed so and so many systems per property. That's a little bit too detailed to get into now. But if there are multiple owners on a single non-CPR property, then these owners would be jointly responsible for the upgrade of the cesspool on this property. I hope that answers the question.
Yeah, thank you. And a couple more people. One person asked if the Cinderella comes with a glass slipper. It is a very odd name for a toilet, the Cinderella incinerating toilet. And so, but then we realized this is a Scandinavian company, and they invented Cinderella, whose name is Cinder. She used to sweep the cinders from the chimney. So we realized, oh, actually that is a perfect name for it, but no glass slippers come with it, but everything else does in the maintenance kit. And then, by contrast, John asked, are the composting toilets legal? And then Randy said, are there complications in using the byproducts of these composting toilets for agricultural solutions? So Roger or Yoko or.
Yeah, I think I typed in an answer to that. So yes, currently the Department of Health stance is that this composted material would have to be discarded with rubbish. It could not be reused for anything because of health concerns. They would have no way of knowing whether it had been properly stabilized and not have pathogens to spread around the environment, either on your home or someone else's. And then there are vectors which can move material that could include animals and things like that that could distribute it around. So there's a lot of concern about that. So at this point, it wouldn't be used. When composting operations are done at municipal treatment plants, there's a lot of detailed regulations and procedures that have to be followed to make sure that it's safe. And there isn't really any easy way to ensure that at the individual home level. So that would be a red flag for health folks.
Roger. So we're coming up on the last 5 minutes of our meeting here, and I just wanted to touch on a couple questions and topics that we haven't gotten to yet. We do have two folks from the USDA here, and there were a couple questions earlier on about the USDA grants and loan program. So one of those questions was, is there a northern boundary to the eligibility? We saw in that map the southern boundary moving into the more urban area of Kaneohe, but is there a northern boundary to where people are eligible? Are people eligible for those grants outside of Kahalu'u? Clarissa or Cynthia, do you want to answer that?
I can answer that. I think the answer is anyone with a cesspool is potentially eligible. And whoever, yeah, so it's going to be first come, first served, I think.
Yeah, I think that, Roger, for the work for water subsidies, that's the case. I think for the USDA grants, if you live
Oh,
in,
I see.
in a USDA rural area, so the North Shore is eligible, and actually most of the state of Hawaii is eligible. But there are some areas on Oahu in particular that are considered urban. So one thing we can do to help you guys determine your eligibility is share in a follow-up email. We can compile some of the questions that into themes, and give kind of bulleted answers to all these amazing questions that have come through. Thank you guys so much for your participation. And we can also include a map of the eligibility areas on Oahu for those USDA grants and loans.
Perfect. Any other, we want to kind of acknowledge and thank Rep. Kitagawa and Senator Riviere. If either of you have any parting words for us, or.
Sure. Thank you. I just want to thank the WAI team and everyone who has been presenters tonight for just putting this town hall together. It's really important for the community to get this information. I've gotten contacted by various community members who just don't know where to start with cesspool conversion. So I think this has really kind of given just that foundational information that a lot of people need to be able to know what the next step should be. And, thank you so much for doing the follow-up as well with all the questions. I know we didn't get through all of them, but I just wanted to highlight that they did put their email into the chat box. It's info@vicleanwater.org. So if you have questions, you can follow up with them, and they really can help you just get the ball rolling if you're interested in cesspool conversion, or if you have future questions. So just thank you so much for providing this information to the community. I really appreciate it, and I'm sure all of the community members appreciate it as well. So thank you so much.
Mahalo, Representative Kitagawa. We couldn't have done it without you. You helped us launch our first one, so we're deeply appreciative of that. Gil, any final words?
I just want to thank you guys for a very informative presentation. I think the USDA Rural Development Loans is a real nice tool that can be had. The program you guys are doing is exciting, and I wish you a lot of success. It puts this vision in place that there's going to be a lot of jobs, a lot of opportunity as we scale up. I think in the chat there was one question. What can the state do? Well, not this year. The state's broke, just as the economy is in the tank. But as things go by later on, when we start looking at the capital improvement budgets each year, perhaps there's some chunks of money that can go to fuel these projects. I could see that happening. It's always a tug of war to fight for money, but this is really essential. It is a priority for the state, and to the extent I can be of support or answer anybody's questions, as Representative Kitagawa said, reach out to us, and we'll do everything we can to align you with what you need.
Thank you for reaching out for USDA. Thank you.
Our pleasure. And this is not the end. It's the end of the presentation, but it's only the beginning of the discussion. We want to keep it going, and we hope we can continue offline. And for those of you who stayed the whole time, we really appreciate your interest in this, and we want to continue talking about it because it's such an important and beautiful area, and especially with so many beautiful fish ponds and just farms that are coming up. So I want to thank Mahina for opening Oli, and our panelists, Dr. Roger Babcock, Cynthia Jackson, Clarissa Sacco, and Michael Mezzacapo. Our WAI team, I've got such a great group of people. Thank you so much. And especially to Senator Gil Riviere and Representative Lisa Kitagawa. So thank you. Please be in touch, and we will continue this discussion and look forward to hearing from you. Aloha.
Thank you very much, everybody. Aloha.
Aloha.